My name is Surrogacy is the assisted reproduction method which has been around a very long time. The first traditional surrogacy was performed 2,000 years ago before the birth of Christ, as mentioned in the Holy Quran of Muslims and the Christians' Bible. Sarah was the wife of Abraham, and she was sterile, which made her unable to conceive. Hagar was a female servant of Sarah who asked to carry a child for Abraham so they could have children. Afterward, Hagar delivered a son for Sarah, named him Ishmael. I found it interesting that even before we knew what surrogacy was, it was practiced in Bible times. A type of surrogacy called traditional is performed by artificial insemination of the surrogate with sperm of intended father, and the usage of this form of surrogacy has been reduced. This surrogate mother not only carries the embryo till full-term delivery, but also provides the eggs that make her a genetic parent. This type of plan causes a whole bunch of potential legal and emotional complications, which is why few intended parents choose this route. The most popular form of gestational or IVF surrogacy is in which the embryo from the intended parents or from a donated oocyte or sperm is transferred to the surrogate's uterus. In gestational surrogacy, the mother who carries and delivers the child, which is the gestational carrier, has no genetic relation to the child. Gestational carriers receive a financial compensation for their commitment, time, and risks involved. On average, surrogates can receive between $40,000 and $50,000 for their willingness to carry a child. Expenses such as travel and medical expenses are covered as well. It is correct that the surrogate has rights, but the right to keep the child is not one of them. Once legal parenthood is established, the surrogate has no legal rights to the child, and she cannot claim to be the legal mother. In the same way, the contract protects the surrogate from any kind of legal or medical responsibility for the child. The reasons for surrogacy include absence of the uterus, recurrent pregnancy loss, repeated IVF failure, poor obstetric history, contraindications of pregnancy, and excessive maternal risk. Surrogacy is a selfless act, but the surrogate mother is entitled to rights and protections as well. Some of these include the right to health insurance. The surrogate has the right to be informed about any medical procedure and the potential side effects. She has the right to justice and not be the victim of maleficence. She has the right to choose her medical team and medical treatment. She has the right to have counseling to help at any point during the pregnancy, and she has the right to receive the compensation and/or reimbursements agreed to in the legal agreement. I think it is important to consider the psychological aspects of surrogacy. Prior to the birth, there should be ways to safely terminate the relationship between the gestational mother, the surrogate, and the child. It is routine to hand the child over immediately after birth and as part of the process, but psychological therapy can include a technique called cognitive restructuring to help the woman develop an emotional barrier to the carrying of the baby. There is a concern for most intended parents that the surrogate will form such a strong bond that they won't be able to give up the child. After the baby is born, doctors encourage the intended parents to engage in frequent skin-to-skin contact immediately to promote proper bonding. The surrogate has rights to her own body and autonomy over her decisions, and she might need a few minutes to take all this in. A surrogate pregnancy introduces challenges on both sides. The surrogate mother may have a tough time explaining herself to her children and other family members. Intended parents who come to the process as a last resort may find it challenging to discuss their relationship with the surrogate mother and to others. Then there is the delicate subject of explaining the process to the child once they are old enough to start asking key questions. I think surrogacy is a beautiful thing. I think handling both parties involved is vital to achieving the full benefit, especially for the child.